it's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
Hi everybody, I'm Blanche and thanks for the introduction, Errol. So like Errol had said, I do have a special interest in pediatric physiotherapy. So let's get started. Let me just share my screen. Can we all see the screen, Errol? Yeah, perfect. So today we'll be talking about the ABCs of juvenile arthritis, again, a very niche area, but people who are joining us in today, if you do have juvenile arthritis or had juvenile arthritis or know of people who have juvenile arthritis, this might be of something that's helpful in terms of understanding the symptoms and management options. So to start off with, what is juvenile idiopathic arthritis? So it's a very niche area again. Juvenile means young people. Idiopathic means we don't know what is the cause. Arthritis just means chronic inflammation of the joints. And it's quite important to bear in mind that 25% of the people don't experience any pain and only swelling is observed. I think in juvenile idiopathic arthritis, a lot of people sort of misunderstand what type of arthritis it is because you hear a lot of different types of arthritis, but in juvenile arthritis, it mainly is just an umbrella term to outline kids who are under the age of 16 who have symptoms of arthritis for over 6 weeks. So that's the general definition of it. Now, I just thought it's interesting to look at what kids say, how arthritis have impacted them. So this is actually from the Juvenile Arthritis Foundation. So their question was, what is it like to have arthritis? So they were asked these questions. And Juliet, who's 7 years old, said, it's sometimes scary because of joint injections and my weekly needle as a medicine, but it is also sometimes a little bit fun because of arthritis camp. So 11-year-old Harry said, having arthritis makes me sad and I feel like a stiff, sore old man. When I wake up in the morning, I cry because it hurts so much and mum has to dress me. Some days I can't go to school. I have lots of tablets and needles. It helps a bit with the pain, but it doesn't help with being stiff. Doing my karate helps condition me to deal with the pain. I wish I could feel normal and get better. I have pain in my toes, ankles, knees, back, hands, shoulders, jaw, and eyes. This just comes to show that even in little kids, they also recognize and understand how inflammatory arthritis itself doesn't only impact them on the symptom side of things, but also not being able to do things like dressing themselves, just the most basic daily activities. If we look at other descriptions, so these are other kids who have been asked, they said, living with juvenile arthritis is like living in constant pain and having to manage everything you do to ensure you'll be okay. Living with juvenile arthritis is like missing months of school due to joint flare-ups. It's like something that I and many others have to live with on a daily basis. But thanks to my specialist, my arthritis is now reasonably controlled due to access to biological medication. However, the damage that has been done to my joints is irreversible and limits my function. In a nutshell, juvenile arthritis creates constant pain if not managed properly and limits what I can do, as every move can risk time off school and away from my friends. So again, the impact of the inability to participate in the most basic activities like school or in adulthood, work. We then asked them to draw pictures. So one kid actually drew a picture of herself and I assume a nurse injecting herself. And of course, it's the unpleasant feeling. And she had described that it is hard sometimes because it hurts and I don't like having my needle. And again, other pictures that describe how, just illustrates how it's an unpleasant experience for a lot of kids. This is an interesting one because this is from a 19-year-old. So looking through little kids all the way through to adolescents, it impacts people differently. So in a 19-year-old, she says that I'm dealing with intensified pain. I may have to cancel plans, reschedule work, apply for extensions on university assignments, or factor in extra time to deal with my pain throughout the day. I always must make time for and plan for my monthly blood tests and my tri-yearly rheumatology appointments, physio appointments, therapy appointments, ophthalmology appointments. Again, so many medical care that seems to be impacting her, and having to fork out time to actually attend these appointments seem to be the main gist of this description. And she also says, taking approximately 10 tablets a day and an injection once weekly also becomes monotonous. It makes me feel like an outcast to my friends. I have to be mindful of when I have to take certain medications because it impacts the time I spend with friends. For example, I might need to accept that I cannot dance for a night, not drink, or must leave an event early. So again, I think it is the impact of having to make room for these experiences. And it's not necessarily related to just having joint pain, but it's having to work around making these appointments and managing the condition, which is the biggest impact as kids start to realize how arthritis could impact their pain and their function. So this is an interesting question. So then they asked, what would you do for juvenile arthritis if you were the Prime Minister? So I thought this is quite interesting to see, because it would be good to look at what a child's perspective would be if they could potentially try and treat arthritis. And so one kid said, get way more pediatric doctors. It is terrible having only few doctors that can help. And it would also be good to get schools to learn about juvenile arthritis so that teachers, friends, and older kids know how it feels. If I was Prime Minister, I would open a camp for kids with arthritis, and it would be a school with a bed, kitchen, bathroom, clinic, and blood testing room. It would also have physios, doctors, and a nurse. So very innocent thoughts, and it comes to show that this is the reality, right? And Nyla, age 6, said, I would make medicine that isn't a needle and help kids to play that has arthritis. And a bit more, so this is the last one. Harry said, I would pay for someone to find a cure. I would pay for doctors in Tasmania because we don't have any that look after kids with arthritis. Again, it taps into access of healthcare. The other one said, I would give money to doctors and schools so they can help kids like me. I would give money to scientists so they can learn more about arthritis. I would make sure everywhere had ramps instead of stairs. Environmental access is one thing that they looked into. I'd listen to kids with arthritis. Age 12, Sinead said, the first thing I would do is spreading awareness so people actually know about it. For example, advertisements and posters. Next, I would hire many more specialists for hospitals. And lastly, I would fund research into new treatments and maybe even a cure, as well as helping families pay for medicine and medical care. Additional thing, this is the important part, she said, I would instruct the NDIS to make a plan for kids who don't have permanent damage due to their arthritis to prevent further damage. Comes to show that even kids have this awareness, and age 12 already know that it's such a grey area that these people suffer from such invisible illness and don't even have the right access and funding to even access things like NDIS, even though they feel disabled or have debilitating effects from their arthritis. So this is just a bit about how juvenile arthritis is. So I think the definition didn't really explain what it was, but reading through what kids have actually explained, it tends to show us a little bit more about how it actually impacts them. I like this diagram because it illustrates how living with a chronic condition, not only juvenile arthritis, but any form of arthritis, is really like playing the classic board game of snakes and ladders. You might sort of reach the bottom of the ladder. You feel like, okay, I'm starting to meet the right rheumatologist. I'm on the right medication. I have a good team of physios, EPs. I'm moving up the ladder. I'm finally feeling like I reach a bit of success in managing the condition. Then all it takes is a flare, or all it takes is not having the financial stability to access medications, or just lack of awareness from other people around you that understands the condition to let you slip off that slippery snake to go back to the beginning phase. So I think with anyone here who experiences chronic pain, it really is like playing a game of snakes and ladders, and it's not always ladders. You can encounter snakes. And again, it is our role as health professionals to help you navigate, to hopefully, it is a bit of a gamble. You still roll the dice and you might still encounter a snake, but hopefully avoid some of those snakes. So again, to summarize, I think the problem is these four problems: pain, disability. It's a constant battle. There's no cure. With pain, it's daily. It's often quite severe with any form of arthritis. So if anyone here experiences rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, you'll know that, many joints can be affected as well. There's pain that can disturb sleep. You can feel lonely, depressed. For kids, it prevents play, learning, and in older people, in adulthood, work. There's disability because in people with joint damage and deformities, it leads to poor biomechanics. They can't move as well. There might be a loss of vision in some cases, or effects on internal organs. It can prevent you from functioning normally, and even from childhood to adulthood, family activities, sports, socializing. And a lot of people describe it as a constant battle because it's unpredictable flares. They say that they can walk at night, but they can't walk in the morning, or they settle in the afternoon, but then suddenly they can't move, they feel stiff. It's the time taken going in and out of their usual daily schedule routine to travel for appointments. It's the mental and emotional toll of the pain and the social isolation that people feel. Again, there's no cure for juvenile arthritis or any form of inflammatory arthritis, but treatment can help to reduce pain and maximize mobility and prevent disability. But of course, it often involves steroids, immunosuppressants, and anti-inflammatories, and often these pose side effects, and in some cases, serious side effects. And let alone other testings, which can be unpleasant. Blood tests every few months, injections are very, unpleasant, and they can also lead to a feeling of just, unpleasant experiences throughout your life that that you can't get away from. So just to describe juvenile idiopathic arthritis, it's an umbrella term once again, and I really like describing it as though it's the seven dwarves or the Smurfs, because there's many different subtypes. There's so many different types of arthritis that mimic each other, but they're slightly different in their symptoms and how they present. And this comes to show how difficult it is actually for rheumatologists or pediatric rheumatologists to formulate a diagnosis really early on, because they can mimic or symptoms overlap, and it can be very difficult to then define which arthritis you might have. So in juvenile idiopathic arthritis, normally with normal people who are healthy, our immune system attacks things like, foreign materials like bacteria or virus. But our immune system in juvenile arthritis tends to focus on targeting synovium, which is the joint lining, the lining of the fluid layer near joints. And that becomes a target organ for inflammation. And again, with inflammation, it then leads to a proliferation of even more synovial tissues. So there's more inflammatory tissues, and there might be fluid in the joints. And again, with fluid in the joints, it can then lead to pain, swelling, and discomfort, and people then can't move properly. And in terms of progression, of how it progresses, if you have constant inflammation of that important protective fluid layer, it can then lead to joint destruction. And then the next step is that it might destroy your bones, tendons, and ligaments. So we really want to prevent even joint destruction when people can identify that there's inflammation in these synovial tissue, which is, again, the protective fluid layer in the joints. So I just wanted to know how your juvenile arthritis journey is like. And I know not everyone here may have juvenile arthritis, but for those who even just have, any form of inflammatory arthritis or chronic conditions, your journey might be somewhat similar, because it's often very difficult and arduous. Like, you might go through a roadmap like this. So this is actually a roadmap of what a typical juvenile arthritis patient goes through. The top shows what people go through in the public system. So typically with juvenile arthritis, it's Westmead Children's Hospital or Sydney Children's Hospital that they get funneled through. And then the bottom is the private system, which is if they go to a private clinic like BJC, for example. The average time to get through to, even in the public system, to even get through to seeing a doctor in the public system takes around 7 to 28 months, even though they've been in pain for so long. So the first 3 to 12 months is just even waiting to be triaged. And then there's 2 to 6 months of time where the public system has to triage these kids to then go, yep, they can be classified to go into this clinic. And then it takes 2 to 4 months to then go into a list where there's a monthly juvenile arthritis clinic in the hospital system for them to then get a diagnosis, and then let alone treatment options, which can then be really delayed. Of course, in the private system, it's a lot quicker, but there's still lengthy waiting times. And for those who are interested as well, by the time kids then get the diagnosis, 36% already present with silent uveitis. Uveitis is an inflammation of the middle layer of the eye, the uvea, and that tends to lead to permanent damages to the eyes. And if they have to wait that long and they already have symptoms and joint destruction to the ligaments and tendons, you can really see how delays of these treatments can make it really hard for interventions to work well. So in terms of diagnosing juvenile arthritis, normally rheumatologists would run through a whole lot of blood tests. Now, you wouldn't have to know any of these blood markers, but for those who are interested, they look at inflammatory markers like ESR, CRP, and they look at other things like rheumatoid factors. If you're positive in your rheumatoid factor, which is a type of it's just from your blood test, it's an inflammatory marker. It then predicts more sort of longer term erosive joints in polyarticular juvenile arthritis. If they have ANA positive, which is another marker that they look in the blood type, then it increases their risk of getting inflammation in the middle layer of the eye, uveitis. If they look at other things like genetic tests like HLA-B27, it then increases risks for, and if you're positive in it, increases risk in getting inflammation that is related to where the tendon attaches to the bone and arthritis related to that. If they look at imaging, usually we find that there's inflammation in the tendons and the joints. So X-ray and MRI findings tend to show erosive changes and inflammation. So this is an MRI of a child with juvenile idiopathic arthritis. This is the knee, and you can see the bright white spots, which shows swelling, and they call edema, which is swelling, fluid in the joints. And again, it's where the synovial fluid, again, the synovial, which is the connective tissue that outlines the joints, get inflamed. So people will go through these testing to then allow the doctors, the rheumatologists, to make that diagnosis. There's, again, many different types of juvenile arthritis. And if you think back to that Snow White and the Seven Dwarfs illustration, this is pretty much it. There's so many different types. Oligoarticular arthritis is when there's less than 5 joints involved. It's when the joints that are affected are usually asymmetric in pattern. So you might have joints that are affected in the shoulder and then joints, affected in the ankle, for example. With polyarticular juvenile arthritis, it's when there's 5 or more joints that are affected, and they're usually symmetrical in pattern. With systemic juvenile arthritis, it's when there's any type of arthritis in the body, but also potentially organ involvement. So let's say heart, liver, or lungs. And then, of course, there's other types like enthesitis, psoriatic, and undifferentiated arthritis. So there's so many different types. And to even get to this stage where people make the diagnosis of juvenile arthritis, it would have taken so long already. So again, early diagnosis and early even public awareness. So you guys even just attending this event and knowing about it, you could potentially help a friend who may have these symptoms to get earlier referrals to rheumatologists or GPs. The management of juvenile arthritis is actually not very different from managing any form of adult type of arthritis. So it's still non-steroidal anti-inflammatory drugs to begin with, and then potentially joint injections, so steroids or oral steroids. You might have heard of this medication called methotrexate, which is a systemic anti-inflammatory. And of course, they have to do blood tests, monitoring every few months to make sure your liver function is fine, and also other biologics. And often with juvenile arthritis, it's not just the joints that we have to treat. We also have to treat other complications, and that can sometimes be leg length discrepancy. So if people have joint erosions in their hips, ankles, or knees, that can lead to one leg being longer than the other, in which case they might need special shoes to just adjust that discrepancy, or in some cases, some operative procedures to help with managing that leg length discrepancy. For those who have inflammation in their eye, there might be frequent ophthalmology reviews and screening, especially if their blood test ANA shows positive. With muscle contractures, that's when physio can come and help to make sure that the contractures are well managed. There's still lots of room for muscles to move, and there's good movement patterns and biomechanics. And in some cases, rare cases, there might be Botox injections or muscle relaxants that might be needed to improve these contractures. So a lot of people ask me, do juvenile arthritis persist through adulthood? So some people here might have an adult form of arthritis, but back then had juvenile arthritis. So when they looked at research, they found that 50 to 60% of patients with systemic arthritis tends to continue to have active diseases in adulthood. And 40 to 50% of patients with oligoarthritis, which is the type of arthritis that affects less than 5 joints, tend to also continue to have active disease in adulthood. This is quite a significant amount of patients who started off with juvenile arthritis that could then still have active diseases in adulthood. But again, whether they had continued to be followed up until adulthood might be a different question, a whole different topic to talk about. And between 25 to 50% actually need major surgery, including joint replacements. That's still quite a lot of people that needs joint replacements at some point in their life. It might not be when they first got diagnosed with juvenile arthritis, but later down the track. Again, patients with this type of oligoarticular arthritis tends to frequently develop that leg length discrepancy. And again, if people walk with a bit of a limp because they've got that leg length discrepancy, it can really impact their other joints and how much pain they might have in other areas of their body. And also potentially periarticular muscle atrophy, which is deconditioning of the muscles around the joints. Of course, in the ideal world, this is for everybody with chronic conditions and with any form of inflammatory arthritis, multidisciplinary approach, which is the involvement of all health professionals, would be the ideal sort of approach to managing this condition. But it is whether we can even, if people can fund for these things. There's not a whole lot of support for inflammatory arthritis in accessing all of these services. So people might have to prioritize whether they need one more than the other. But in the ideal world, this is the coverage of how it should be managed. So a pediatric rheumatologist, of course, to look at medications, rheumatology nurse to provide support and coordinate the treatment plan. Again, no different to adult sort of arthritis. You still want that person who coordinates your care. GP to look after your general health, ophthalmologist to check that your eyes are fine and screen for inflammation of the eye, nutritional therapy, physiotherapy, psychologist to help manage that social emotional difficulty of even being told of this diagnosis, orthotists to help if you have leg length discrepancy, dietitians to write your meal plans to keep you healthy. But again, in the reality, people probably only access one or two of these services or none because they can't even afford going to see their rheumatologist, let's say. So I think, again, government funding in this space is very important to make sure people get proper care of their arthritis.
So you've just finished watching part 1 of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. Otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in an event soon.